this glue ear, and she just so happened to move house with no humidity, excessive humidity anyway, and her symptoms resolved, and she had multiple grommets fitted as a result. It was just due to the humidity within the house. So this patient's going to just try dehumidifying the house just to see if that helps, because otherwise they're going to have to come every 6 months to have this ear clean, which is fine. I'm more than happy to do it. But for the patient themselves, it's for the rest of their lives having to have their ears cleaned every 6 months. It's kind of a big undertaking for them. So we're going to see if it works. They're going to speak to their doctor to see if they can get referred to a dermatologist. They may be able to offer better advice as well, because that's what they do. We'll take some swabs of the ears, some blood tests, check for any allergies. And the patient's doing everything else right. They are avoiding water in the ear when they're showering and bathing. And they're not poking and prodding in the ear. So similar to the patient's left ear, the epidermis layer of skin here, once it's revealed, once we remove all this debris, it's quite inflamed, it's sensitive, so again we want to avoid touching it. In both cases, it was like the game of operation. We're just trying to avoid touching the canal wall. No doubt on occasions we did make contact, but it was very minimal and noticeable to the patient. On this outer third of the ear canal, I am putting a bit of pressure on there because this is less sensitive for the patient. It's more the bony part that was sensitive. And I'm just scooping away and vacuuming at the same time all this debris that's collected in the ear. Just a bit of skin at the roof of the ear canal. So it's quite a tedious procedure. It's quite a time-consuming procedure. If I used suction initially, it would have been a lot quicker because I could clear larger volumes of debris, dead skin, the ointment that they're using in one go. But because we use a Jobson horn and using a fine end suction probe to minimize excessive noise in the ear, it's just taken us a lot longer. So on the bony part here, just trying to hover over. There's a piece of skin here. You'll see that it was toying with me. It started to peel, but it kept flapping back, and I had to come in and out of the ear several times just to reposition, get a better grip, get an angle with the sucker to finally remove this. Definitely, this patient should not have their ears irrigated or syringed, because the water will only exacerbate their symptoms and their condition. So we're going to keep it as dry as possible. That's the secret. So just going to go back in and try to lift this layer of skin. There's very little margin of error here. So this layer of skin is probably approximately 0.1 millimeters in thickness, so it just gives you some perspective. And just slowly going towards the eardrum and lifting the sucker up just to detach it. You can see it's just peeling away. Now, the patient wanted me to get as much skin out as possible. It was their choice because all that debris was exacerbating their itchiness and irritation. So the patient's aware of the